Hello, lovely. Heart disease and menopause. Heart disease is the leading cause of death for women in the United States. Nearly half of women entering menopause have no idea that the cardiovascular risk is climbing and going up. And by age 60, heart disease affects 1 in every 2 women, so about 50. So we've got hot flashes, night sweats, mood shifts in anxiety, right? They're just not inconvenient. They can reflect this deeper body change that's happening during menopause that involves our blood vessels, our metabolism, and our nervous system. So I'm so glad that you're here. Stay with me today. I'm going to walk you through what's really happening inside your body during the shift and the practical, doable steps I help women use to protect their hearts during the transition. So we want to have a smart strategy moving into menopause. And you're watching straight from the doctor's desk with me, Dr. Andrea Purcell. I am a naturopathic doctor who specializes in guiding women through those hormonally intense years of perimenopause and menopause. And here's what I want you to understand clearly. Menopause is not a disease, okay? It's a metabolic shift that literally affects our entire body, every system that we have. And if we ignore the signs, whether it's in our heart, our thyroid, our bones, we're going to have to pay a price. So today's topic specifically is about heart health. And estrogen plays a role here because it's not just a reproductive hormone, it's vascular protection for us for the first 50 years. It keeps our blood vessels flexible and bouncy. It helps healthy cholesterol patterns. Estrogen maintains insulin sensitivity. It helps regulate inflammation. And as estrogen begins to drop, several things start to happen. Arteries start to stiffen, so they're not as flexible and bouncy as they used to be. Cholesterol levels, especially bad cholesterol, can rise. Belly fat starts to accumulate more readily because of the rises in insulin. And blood sugar regulation just becomes less efficient. So this whole combination of things is what increases our cardiovascular risk. And it's not dramatic. It's gradual, right? It's like a lobster in a pot, which is exactly why so many women miss it. Because heart disease in women rarely presents the way it does in men. So we're not going to have that crushing chest pain. We just may have persistent fatigue, palpitations, shortness of breath, reduced exercise tolerance, some headaches to go along with that, or simply just go to a routine dental appointment only to have them take your blood pressure and find out that it's high all of a sudden. So it's easy to dismiss. We could blame stress, aging, busy life, things like that. But this critical time in midlife is when we need to pay closer attention, not less. So during perimenopause, blood pressure often begins to trend upward in some women. And then within 10 years after menopause, the prevalence of high blood pressure increases significantly. And then, as I mentioned earlier, by the time we get to age 60, women are more likely to have high blood pressure than men, right? So men, they can start developing blood pressure a lot earlier, but it's after 60 that women really, the numbers increase a lot. And that's just because estrogen plays this protective role that we were talking about, and also helps modulate the kidneys, which help with the water balance in the body and the electrolyte balance, which also influences blood pressure. We just really want to be proactive when it comes to our hearts and our heart health. And we want to jump in there before something really starts to manifest, right? And then we go to the doctor and we find out, okay, now you need to be on a medication for cholesterol, a medication for your blood pressure. And all of a sudden, that's where the medications really start to pile up. So what I'll tell you is that there are specific lifestyle steps that actually help when done consistently for this. So body movement. Regular physical activity improves blood vessel function, insulin sensitivity, and lipid patterns, which are the cholesterol. If we strength train 2 times a week, it's helpful. Walking is helpful. Cardiovascular movement is helpful. Sleep is also helpful because it helps regulate our parasympathetic nervous system and help us reduce inflammation. So getting good quality sleep is also important for blood pressure. Also, good nutrition, right? Eating healthy fats, a Mediterranean style type diet, fiber rich vegetables, eating to balance blood sugars, having balanced meals, hydrating yourself properly. And then finally, the big one, stress regulation, right? Any stress can cause anything, and it can definitely cause high blood pressure when we're in that fight or flight type of phase. So anything that we can do, if it's exercise, walking outside, practicing our breathing, taking more time for journaling, a devotional practice, whatever works to help us modulate our stress is very important too. And these are practical steps that I help move my patients through so that you know what to do to help yourself. We look at the labs, we address the disturbances, whether it be in sleep or hormonally, we support nutritional status, we balance the hormones when we need to. And honestly, not every woman needs the same type of intervention, but every single woman deserves evaluation. And you need to know if this is something that you can control on your own with some prevention, or if you really need to seek more serious medical care. So what I would say is this stage of life demands alignment, and we have to learn how to take better care of ourselves during this stage of life. Menopause does not automatically mean heart disease, but it does mean that our physiology has changed. And so some of these things that we're talking about, like body movement and sleep and stress regulation and dialing in the nutrition, looking at what the hormones are doing, these can dramatically reduce your risk factors when you are on a firm foundation. So if you want to be proactive for the next decade or 2 or 3, you can grab my free Perimenopause Power Guide and learn how to put some of these things that we talked about today into practice. Just click on the link below. And until next time, I am wishing you well.